Welcome to the Countess of Chester Joint School. The aim of our service is to provide you with all the information you require for a successful joint replacement journey. In this video, you will learn how to prepare for and take an active role in your hospital admission and subsequent rehabilitation. This will support the information also provided by your surgeon, anaesthetist, arthroplasty practitioner, nurses and therapists. All information provided will also be accessible in a written booklet.
You're here today because you've been placed on the waiting list for total hip or total knee replacement. The hip is a ball and socket joint. The reason you are in pain is because the cartilage has worn out and it is bone-on-bone arthritis. We'll be replacing this with a metal or ceramic head with a plastic liner to allow for pain-free joint movement. The similar thing happens with knee replacement as well. Knee is a hinge joint which allows once again for pain-free movement between movement of metal and plastic. This is where the incision is going to be for the hip replacement, whereby the incision will come from the back itself down to the side of your hip joint. And with regards to the knee replacement, generally you'll have one long incision down the front of the knee. There are risks and benefits of each procedure, and this would have been discussed with you individually with your consultant prior to consenting for surgery for a joint patient decision making. This risk include clots in the legs, lungs, infection, bleeding, as well as pain. We'll help with this after surgery with pain relief, as well as local anesthetic injections around the wound itself that will help with enhanced recovery and early mobilization. And the key here is keep yourself mobile as much as you can, and especially after surgery, we'll be expecting you to be walking on day one, and we will have our very dedicated physiotherapy team to get you up and about for recovery purposes.
Prior to your joint replacement, you will have a pre-operative assessment to make sure that you are fit for your surgery.
Hi, my name is Waylon Yap. I'm one of the consultant anaesthetists in Countess Chester Hospital. I'm going to talk to you about the anaesthetic portion of your journey. You're here for either hip or knee replacement, and most hip or knee replacements will have it done under a spinal anaesthetic, and the other option is a general anaesthetic. In addition to these two techniques, you will have either local anesthetic infiltrated around the wound for pain relief, or sometimes you do something what we call nerve block, which is a different sort of injection to help with pain relief after. As part of your spinal anesthetic, the idea is essentially your anesthetize just from your rib cage down, and as you can imagine, a lot of people are very anxious about that. So on top of that, most people tend to have a little bit of sedation around the operation so that they are not aware of what's going on throughout the operation itself. So as part of the spinal anesthetic, this would be the position that we're going to get you in. We're going to get you drop your shoulders down, drop your chin to your chest, and basically slouch. The first thing we'll do is have a feel of your back and find for the right positions. Once you find for the right position, there'll be a poking and prodding, antiseptic spray onto your back. We'll get our sterile gloves on your back, strap the right manner, give ourselves a nice clean area to work on. What you do then is to put a bit of local anesthetic in your back, and once that's done, you then use a very fine needle to go in your back. You start feeling your body go warm, and then you're going to get you in position for the surgery itself.
On the day of your surgery, you will be admitted to the theatre admissions lounge. You should bring a small bag containing clothing, comfortable footwear, toiletries, your regular medications, and a device to listen to during your surgery. This will be taken over to the joint arthroplasty unit, where you will be admitted to after your operation.
When you get back to the joint arthroplasty unit, a nurse will meet you to assess your pain relief that you may require to enable that you'll get out of bed within the first hours of surgery. You may initially have some numbness in your legs following the anaesthetic. However, it is still important that you ask for some pain relief so that you can start to mobilise without any discomfort. You will be encouraged to eat and drink as soon as possible, but please advise them in advance if you have any dietary requirements. You'll be encouraged to move around, and the therapist will come and assess you within the first few hours of your surgery. Our aim is for you to have a positive experience and for you to be as comfortable as possible while you're with us.
The therapy team consists of physiotherapists, occupational therapists and therapy assistants. One of the therapy team will assess your sensation, movement and pain levels and go through the exercises which will be provided in your booklet. Please start moving your leg as soon as your sensation starts to return. It is useful to familiarise yourself with the exercises prior to admission and start to include them in your daily routine as much as you are able. You will be guided on the best methods to get around, including how to get out of bed and safely stand from a chair and the toilet. An appropriate walking aid and any additional equipment will be provided as required.
If you have a total hip replacement, there will be additional precautions you will need to take. These are: avoid bending the hip beyond 90 degrees, do not cross your legs, and do not twist on the operated leg. You will need to purchase a long-handled shoehorn and helping hand prior to admission for hip replacement. These are not essential following knee replacement, however, may be useful. Prior to your discharge, you will be able to mobilise independently around the ward with an appropriate aid. We would encourage you to do this regularly. You will be assessed on steps or stairs and advised of the best technique appropriate for your circumstances. If you have any concerns about your function or how you will manage on discharge, please discuss these with your nurse or therapist at pre-assessment or joint school. If your circumstances change, please highlight this as soon as possible on admission. Once you have been discharged from the ward, the therapist will refer you for an appointment with one of our advanced therapists for 1 to 2 weeks after your surgery. On the ward, we recommend limiting visitors to 2 round the bed. Please be aware that the hospital cannot accept any responsibility for your property during your stay. Prior to discharge, you will be sent from the ward for an X-ray. Once you are ready for discharge, a nurse will go through all of the post-operative instructions and medication. You will be discharged with pain relief for the first week and possibly blood thinners. If you have been given stockings, they need to remain on for 14 days. The wound should be kept covered and dry for 14 days, and then you will be asked to go to your practice nurse to have a wound check and possibly removal of clips. During this time, we recommend a strip wash. Be mindful of the clothing you wear into hospital and for discharge. Looser, easy to wear clothing is advisable, and shoes with a good grip to stop any slips.
I hope you found this video helpful. Please do not hesitate to ask if you have any further questions.